Hi, I'm Dr. John Neustadt, president and founder of NBI. Last night I did a live Zoom question and answer, Ask the Doc. It was about an hour and 15 minutes, and the questions I got were phenomenal. Hearing directly from folks about what they're struggling with and answering questions that they have is one of my greatest joys. I love it. And one of the questions that kept coming up over and over was about gut health. While there are lots of things we can talk about, I really want to focus on something that a lot of people, and particularly a lot of women, struggle with, and that's irritable bowel syndrome, IBS. I saw IBS, tons of IBS in my clinic, and it's a syndrome. It stands for Irritable Bowel Syndrome. And inevitably what happens in medicine is when there's a suite of symptoms, someone's presenting with a bunch of symptoms and medicine can't quite figure out why or what's going on, well, they clump them all into a syndrome, irritable bowel syndrome. So irritable bowel syndrome really presents with either constipation or diarrhea, abdominal cramping, gas and bloating. You can get headaches and fatigue, brain fog. All of those are very common. And frequently what I found worked is looking at the underlying gut dysfunction, what's going on. And usually it's one of two things, or it could be both, and that is a food intolerance or a food allergy. And the other is an intestinal infection. And to test for both of those, I would run an IgG, food allergy panel, not IgE, E is an Edward. That tests for the type of reactions to foods and other things that can cause the throat to swell up, anaphylaxis. That's not what I'm talking about. There's another immune protein called IgG, and the symptoms of that are more insidious. You eat the food, can cause fatigue after eating, gas and bloating, and there are blood tests that can be run to look at that. So I would run that, and then a stool test for look at intestinal infections to see if those are issues. And oftentimes, one or both of those were the underlying causes. And we cleaned up the gut, got rid of the food that somebody was allergic to, got rid of the infection, and people felt better. So I really encourage you, if you're struggling with IBS, to look at that and ask your doctor, your healthcare provider about that. Because the underlying causes of IBS oftentimes are not that complicated, but unfortunately in conventional medicine, they're either not running the right tests or not asking the right questions. So working with an integrative minded doctor or a naturopathic doctor could really be incredibly helpful to you. So if you have any questions, post them below because I'll be happy to answer them. Head on over to nbihealth.com because we've got some exciting news actually coming in just a couple weeks about testing on our website. Sign up for the newsletter while you're there so you'll make sure that you'll get those announcements. My team and I, we've been working on this project for about a year and a half now. So make sure you head on over to nbihealth.com, sign up for the newsletter so you'll be the first one to be notified when that project gets completed and live. Have a wonderful day, and I'll see you here next week.